Hi champions, hi champs. Mkoaje? Umeshindaje? So this is a continuation of the video that I was showing you. Just next to the sea or port. Well, hakuna zinaitwa aje? There's no ni dock where the mary huwa zina park. So I told you this is Port Augusta, South Australia, blah blah blah. So yeah, Sema is a patient who have rights. Now I wanted to give you a story. It happened in Kenya actually, if you guys can remember, 5 years ago. And from that story, I'll tell you what you should do or what you should know as a patient. Tuachange kuachia kila kitu. Ati wewe unaenda hospitali, hujui what's happening, you don't ask. You have a right for information. Ask for more information. If something is not clear, ask. Where do I start? From the story or from what I wanted to say? So let me say this. Patient, for instance, turudie mambo ya lab. Umetumwa lab tena. How do you know that your blood, venye kuna kuanga very busy kwa lab, huyu lab tech ako busy, ako peke yake ama wako wawili na wako na kama 100 people. Kila mtu anaenda kwa daktari, anapewa karatasi, anapushiwa na ambiwa aende kwa lab akatolewe damu. So how do they verify? R na L zinaleta matatanishi. You can clearly tell where I've come from. So how do they verify that this is the blood for the right patient? It can be crazy. People get busy and fatigued and hungry, and their blood glucose has gone down. They are not even thinking anymore. Wako na hii kazi mingi, and then here they have 100 people to attend to. How sure are you they won't mix your blood? It has happened to other people. Unajipata nawapea story ingine. Unapata mtu anatibiwa magonjwa sio yake. So say should be able to, or they should be able to verify you. Ukisikia mtu anakuuliza majina, people have got the same names. In some cases, people got same names, but it's rare for someone to have the same date and the same name at the same time. So there is this thing. It's called 3 points identifiers, or 3 ID point check. And one is, what am I saying? 3 points of ID check. One is your name, your full name. Make sure umeulizwa your full name. If it's 3 or 2, mostly back home watu wako na 3 names. Well, or most of the people have got 3 names. The other thing, it's your full date of birth. This is a mandatory, by the way. Should be a mandatory. It reduces the accident that happens when medical error happens. So make sure you give your full date of birth. Third one, it's it's your number, maybe umepewa number. Sometimes maybe number sana sana zinapewa kwa watu wenye wamelazwa kwa hospitali. So maybe if you are an outpatient, you're not admitted that day, ni ngumu kupeana number, but there is something else you need to give, whether it's your card number that you're using, something number, hata kama ni insurance number. Yeah. So 3 points check. So this should happen ukienda lab, that is one place. Before upewe dawa, tuseme uko kwa ward na wewe ni patient, the two, and especially the IV medication, you know, IV zenye zinawekewa kwa vein, hapo inaweza kupea a very inaitwa adverse effects, very dangerous effects. Ishawekwa kwa vein yako na imepewa the wrong person. It has happened hata wapi, everywhere, but people don't take, we should learn. So nilisema hii channel ni ya kulearn. Hata kama wewe ni patient, you should know these things. You should know this thing. Ukiona a healthcare provider, someone attending to you, whether it's a nurse, whether it's a lab tech, whether it's a doctor, they should check these things. Ask them, tell them their names in a respectful manner. Tell them your name and confirm whether they've really made sure you are the one. So, this story nilikuwa nataka kuambia. Huyo patient 5 years ago in Kenya, if you can remember, hata bado iko kwa media, social media. There was a patient alifanywa brain surgery and it was the wrong patient. And you know why? This is the main thing. This is what happened. They didn't check, they didn't confirm to see whether this is the same patient, the date of birth. You know, those things should happen not just in a one instant, like in a one spot. You know, I'm trying to say, tuseme huyu patient alikuwa anatayarishwa kwenda theater, so amepitia mahali kwingi, amepitia maybe kwa scan, ndio afanywe scan ndio onekane shida yenye yako nayo. Huko kwa scan lazima angaliwe kama ni yeye. Amepitia kwa nurse, maybe nurse anamtayarisha, nurse anafaa kuhakikisha to repeat these 3 points of ID or identity. Anafaa kuhakikisha whether it's still the same patient. Then don't get tired of being asked your name. That's another thing. Patients wanashangaa, but the healthcare provider should tell you that, should let you know that you're gonna be asked this question a lot. What's your name? What's your ID? What's your full date of birth? Now this applies even to those patients that are unconscious or are not able to speak. You know, they are very sick patients still. This applies to them as well. So mostly kenye inafanyanga, so mtu kama huyo una assume hayuko outpatient mwenye mgonjwa sana, so lazima akuwe maybe ward, na kwa ward so atakuwa amepewa ka tag. Hiyo tag yake kwa mkono ama wherever imewekwa, lazima nurse akikuja kumpea dawa ama akikuja kutolewa damu, lazima ahakikishe ni the same patient, aangalie jina, counter check na hiyo form, lab request form, a counter check, because you have to counter check when someone is telling you their name. How sure are you they are the ones? So maybe umepewa hiyo lab form, they should counter check whether to see, tick this is the one, tick this is the date of birth is the same with this one, and then ID number is the same with this one. Still same happens to blood transfusion. Imagine ukiekewa the wrong blood, ama uwekewe blood sio yako, maybe you are O negative, and we know O negatives they can only receive from a certain people. I think still O negative. We're gonna talk about bloods as well, blood groups and all those things. in a different topic, and then upewe for the wrong patient the wrong blood. Unaona, you can easily die. So yeah, so nikasema hiyo brain surgery went wrong because people failed, maybe the records. So this thing should happen every stage in the treatment wherever you're going. Yeah, so hata ukiona healthcare provider mwenye haulizi hizi vitu, just make sure they are doing it to the right patient. So another story I wanted to tell you ni, so huyu patient alikuwa anatolewa damu. They had same names, but different date of birth. But they had exactly 3 names the same. So huyu patient akapangiwa, kukawekwa request form, anafaa afanyiwe tests. So akatolewa damu. So they called the wrong patient. Let's start getting this. Listen carefully. They called the wrong patient. After calling the wrong patient, so wakamtoa damu. Hawakujua because jina, nurse mwenye alimuita aliangalia jina, haku confirm the 3 identifiers: the name, the date of birth, or the ID. Those 3. So alipokosa kuangalia, so si aliona ni jina inafanana na ile jina iko kwa ile form. But most of the time people do mess up, maybe they are busy like I said. Anywho, so akatolewa damu na results kutoka after maybe 3 days or 7, a week. Huyu jamaa alitolewa damu, alikuwa na ugonjwa ya hepatitis. But so wakipeana results, so hizo ni results, but wakipeana results waliita the right patient, because maybe this time they had to confirm this date of birth person. Yeah, wakaita the right patient. So the mwenye alikuwa anafaa kutolewa damu, but hawakuwa wanajua bado. So huyo akamwambia hakuna mahali alitolewa damu, walikuwa wanamuita kumwambia utaanza treatment. You know, hepatitis C, tunaongea hizi magonjwa. Hepatitis C inakujanga na, they are infectious diseases. Inakujanga na maybe people have injected, maybe those people who use drugs, maybe wametumia the same needles, they've shared the needles, or mostly it's sexually transmitted diseases. We're gonna talk about all these things in here. So akamwambia yeye hakuna mahali alitolewa damu. Lolo, what did they do? So they now came to their senses that we did the wrong. We took the blood samples for the wrong patient. So wakaita patients wote wawili. Naona mistake yenye ingefanyika, huyu sasa angepewa madawa mingi na injections zenye sio zake. So they came back to their senses, they wrote a report. There's a report that you should write as a medical or a health profession. It's called SLS, to raise that there was a mistake happened. A mistake happened, and so that it doesn't happen again. Yeah, ndio watu wa learn. So wakatoa sasa the right patient, na yeye wakamtoa damu, wakaverify this with the 3 points of IDs, na wakamtoa damu, na yeye pia alikuwa na ugonjwa ingine. So they treated both patients the right way. So it's same like the story ya mtu wangu. Imagine mtu akienda surgery kwanza hiyo. Unaenda brain surgery. Unafunguliwa. So sometimes, most of the time, patients are not in the right mind. So sisemi, I'm not even here blaming patient, but if you're in your right mind, please speak up. Hapa ndio tunasema rights. I'm relating all this to your rights. Speak up and also make sure you're getting the right treatment and right information. That's part of it. So speak up. So yeah, imagine, okay, that is very, I don't know what I can say. Imagine the wrong patient amefunguliwa. So your patient hakuweza kusema sio yeye akona shida ya brain. That is very, very sad story. And that is just one of the instances. It happens. But I'm just here to enlighten everyone. If you're a patient, if you're a healthcare provider, please make it a habit. Make it a habit to confirm the 3 names. Ikipata any patient, just make it a habit hata kujua rights zako. Alright people, it's so windy. Tutafikisha hii video hapa. Like, share, subscribe guys. Subscribe if you feel these videos are helping you. This health information is of help to you. Yeah. So, and comment, and we're gonna learn more. Thank you. Bye.